Caring for a sick cat requires attention, patience, and sometimes veterinary help. When your cat shows signs of illness, visiting the veterinarian should always be your first step. Cats are masters at hiding pain or discomfort, so even subtle signs like reduced appetite, hiding, or decreased activity could indicate a more serious health issue. Unlike humans, cats cannot express their symptoms clearly, and minor issues can escalate quickly without proper care. A professional veterinarian can perform a physical examination, run diagnostic tests, and provide an accurate diagnosis that you simply cannot achieve at home. Taking your cat to the vet early not only helps in identifying the root cause of the problem, but also increases the chances of a full recovery. Delaying a vet visit could result in worsening symptoms, making treatment more complicated or even risking your cat's life. For example, symptoms like vomiting, diarrhea, coughing, or limping might seem minor at first, but could be signs of infections, organ issues, or chronic diseases like kidney failure or diabetes. Only a vet can distinguish between a passing issue and something serious. Moreover, many common symptoms overlap across different conditions, making it almost impossible to treat your cat correctly without professional help. A vet can prescribe the appropriate medications, whether antibiotics, pain relievers, or specialized treatments based on the cat's condition, age, and medical history. Attempting to give your cat human medications or over-the-counter pet meds without guidance can be dangerous and even fatal. A veterinary consultation ensures your cat receives safe and targeted treatment, preventing further complications. Veterinarians also provide guidance on supportive care during recovery. This might include changes to diet, hydration techniques, or administering supplements. In some cases, hospitalization might be necessary for close monitoring, for fluids, or specialized procedures. The vet will also schedule follow-up appointments to track your cat's progress and adjust treatment as needed. Visiting the vet builds a medical history for your cat, which is valuable in managing long-term health and preventing future illnesses. The vet may identify underlying conditions or early-stage diseases that aren't yet showing obvious symptoms, enabling proactive care. Regular checkups, even when your cat isn't visibly sick, are essential for maintaining overall wellness. Ultimately, consulting a veterinarian is the most responsible and effective step in caring for a sick cat. It provides clarity, direction, and peace of mind, knowing you're giving your cat the best chance at a healthy recovery. Providing a quiet, comfortable space is essential for helping a sick cat recover both physically and emotionally. When a cat is unwell, its natural instinct is to seek out a hidden or calm place to rest and avoid potential stressors. A peaceful environment reduces anxiety and allows the cat's body to focus on healing. Loud noises, frequent movement, or too many people or animals around can elevate stress hormones like cortisol, which may delay recovery or worsen symptoms. Choose a location in your home that's away from busy areas, such as a quiet bedroom or a rarely used room. Make sure the space is warm, clean, and has good ventilation. Sick cats often have trouble regulating their body temperature, so keeping the area slightly warmer than usual can help. You can use soft blankets, heated pet beds, or towels to make a cozy resting spot. Avoid placing the bed near drafts, fans, or air conditioning vents, as cold air can make your cat feel worse. Minimize stimulation in the environment. Keep the lights dim or natural, reduce unnecessary noise, and avoid sudden movements when entering the room. If your cat is particularly anxious, a covered bed or a box can offer a sense of safety and security. Some cats feel safer in enclosed spaces when they're not feeling well, so allowing them to retreat into a quiet hideaway is a compassionate way to support them. Ensure that everything your cat needs, food, water, and a litter box, is within easy reach. A sick cat may not have the strength or motivation to travel far, and placing these essentials close by helps prevent unnecessary strain. If the cat has trouble moving or is in pain, place the litter box with low sides nearby, and make sure food and water bowls are shallow and stable to avoid tipping. Restrict other pets and children from entering the sick cat's space. Interaction with other animals may increase stress or, in cases of contagious illness, risk spreading the disease. Limiting human interaction is also important unless the cat seeks comfort or handling. Overhandling a sick cat can exhaust it, even if the intention is to comfort. Maintaining cleanliness in this space is vital. Clean up any messes promptly, change bedding daily if needed, and ensure the litter box is scooped regularly. A hygienic environment prevents secondary infections and promotes a sense of calm. Encouraging a sick cat to eat and drink is one of the most important aspects of home care. When a cat is ill, its appetite often decreases, which can quickly lead to weakness, dehydration, and complications like hepatic lipidosis, a potentially life-threatening liver condition, especially in overweight cats. It's crucial to monitor how much your cat is eating and drinking, and to take immediate steps if intake drops noticeably. Start by offering your cat its favorite foods, especially those with strong smells, such as tuna, sardines, or warmed wet food. Heating food slightly can release more aroma, which may tempt the cat to eat. Cats rely heavily on smell to stimulate appetite, so strong scented foods are often more effective. Choose high-calorie, easily digestible options recommended by your vet to provide necessary nutrients in small amounts. If your cat is on a prescription diet, ask your veterinarian if it's okay to offer an alternative temporarily to encourage eating. Make sure food and water are always fresh and placed near your cat's resting area. Sick cats may not have the energy to walk across the room, so placing shallow dishes close by helps reduce effort. Use ceramic or stainless steel bowls instead of plastic, which can retain odors that deter cats. Change the water frequently and consider offering low-sodium chicken broth or diluted tuna water to promote hydration. If your cat refuses to eat for more than 24 hours, call your veterinarian. They might recommend appetite stimulants, syringe feeding, or other interventions. Never force feed without guidance, as this can cause stress or injury. For cats that won't drink, your vet may suggest subcutaneous fluids or other hydration methods. In some cases, feeding tubes may be necessary for long-term nutritional support. Encouraging a sick cat to eat and drink also means creating a calm feeding environment. Offer meals when the house is quiet and avoid hovering or trying to hand feed unless the cat responds positively. Monitor your cat closely for signs of nausea, such as drooling, lip smacking, or turning away from food, and report these symptoms to the vet. Keeping a daily log of your cat's food and water intake helps track progress and provides valuable information to the veterinarian. Even small amounts of consistent intake can be a positive sign, and gradual improvements often indicate that the treatment plan is working. Following medication instructions precisely is essential when caring for a sick cat. Unlike dogs or humans, cats can be particularly sensitive to medications, and even small errors in dosage or timing can have serious consequences. Veterinarians prescribe specific treatments based on the cat's weight, age, medical history, and diagnosis, so it's important to administer them exactly as directed. Never substitute, skip doses, or stop treatment early just because the cat seems better, as doing so can lead to relapse or resistance, especially in the case of antibiotics. Cats are known for being difficult when it comes to taking pills or liquid medications. If you struggle to give medicine, talk to your vet about alternative options. Some medications are available in flavored formulations, transdermal gels applied to the ear, or even long-acting injections. These options can reduce stress for both the cat and the caregiver, ensuring the full course of treatment is completed. You can also ask your veterinarian or a technician to demonstrate how to give the medication safely and effectively at home. Use a pill popper, syringe, or your hands, depending on what works best for your cat and the type of medication. Wrapping your cat in a towel or blanket to form a burrito can help keep it calm and prevent scratches. Always follow pills or capsules with a small amount of water or wet food to prevent them from getting stuck in the throat. For liquid medications, insert the syringe gently into the side of the mouth and aim for the back of the tongue, then allow the cat to swallow naturally. Keep a written schedule or use a phone app to track when medications are given. This helps avoid missed doses or double dosing, especially if multiple people in the household are involved in the cat's care. Note any side effects, such as vomiting, diarrhea, excessive drooling, or changes in behavior, and inform your vet immediately if these occur. Some side effects may be normal, while others could indicate a problem that requires adjusting the medication. Store all medications according to the instructions provided. Some may need refrigeration, while others should be kept in a cool, dry place. Make sure they are out of reach of children and other pets to avoid accidental ingestion. Always check the label before each use to ensure you are giving the correct medicine at the correct dose. Monitoring your cat's symptoms closely is a critical part of caring for a sick feline. Cats often hide their discomfort, so it's essential to pay attention to even the smallest changes in behavior, appetite, or physical appearance. Keeping a detailed daily record can help you detect patterns or worsening conditions early and provide your veterinarian with valuable information during follow-up visits. Watch for shifts in energy levels, eating and drinking habits, bathroom usage, and social interaction, as these often reflect your cat's internal condition. Take note of any changes in appetite, whether your cat eats less, refuses food entirely, or shows increased hunger. Sudden loss of appetite may point to dental problems, nausea, or organ dysfunction, while excessive hunger can sometimes be linked to conditions like hyperthyroidism or diabetes. Similarly, monitor water consumption. Increased thirst may indicate kidney disease or diabetes, while decreased intake can lead to dehydration, especially in cats with vomiting or diarrhea. Keep a close eye on litter box behavior. Frequent urination, straining, blood in the urine, or failure to use the litter box can signal urinary tract infections, blockages, or kidney issues. Constipation or diarrhea should also be documented, noting frequency, consistency, and color. These digestive symptoms are important indicators of overall health and should be reported to your vet if they persist for more than a day. Observe your cat's breathing and body movements. Labored breathing, wheezing, or coughing may suggest respiratory infections, asthma, or heart disease. If your cat starts breathing with an open mouth or appears to be struggling for air, seek emergency veterinary care. Watch for limping, stiffness, or reluctance to jump, which may indicate pain from injury, arthritis, or neurological problems. Behavioral changes can be subtle yet significant. A normally friendly cat becoming withdrawn, hiding frequently, or showing aggression may be experiencing discomfort or stress. Excessive grooming, vocalizing, or sudden lack of grooming can also be signs of physical or emotional distress. Eye and nose discharge, changes in pupil size, or redness in the eyes should be documented as well, as they may point to infections or inflammation. Weigh your cat daily if possible, especially if it is not eating well. Even a small amount of weight loss can be significant in cats. Use a small scale and record the weight at the same time each day for consistency. Reporting these observations accurately helps your vet adjust treatment, evaluate progress, and intervene quickly if the condition worsens. Maintaining hygiene is a fundamental part of caring for a sick cat, as it helps prevent secondary infections and supports a calm, comfortable recovery environment. When a cat is unwell, it may not groom itself properly due to weakness, pain, or lethargy. As a caregiver, it's important to step in gently to ensure your cat stays clean and comfortable. Regular hygiene not only helps the cat feel better, but also allows you to monitor for signs of discharge, skin irritation, wounds, or other developing issues. Start by checking your cat's coat daily. If it's matted, greasy, or filled with debris, use a soft brush or a damp cloth to clean it. Be gentle, especially around sensitive areas like the belly or legs. If your cat has long fur, it may need more frequent brushing to prevent tangles and to remove dirt or waste. For cats with soiling around the rear end due to diarrhea or incontinence, use a warm, damp cloth or fragrance-free baby wipes to clean the area. Dry the fur thoroughly afterward to avoid skin irritation. Eyes and nose should also be kept clean. If your cat has watery or crusty discharge, use a separate soft, damp cloth for each area to gently wipe it away. This prevents buildup and reduces the risk of infection. Be cautious not to rub harshly or apply pressure, as these areas are delicate. Any change in the color, consistency, or odor of the discharge should be reported to the vet. Keep your cat's bedding fresh and dry. Change blankets, towels, or pads daily, or more often if they become soiled. This not only provides physical comfort, but also minimizes odor and keeps bacteria levels low. Use unscented detergents to avoid irritating your cat's sensitive nose or skin. If your cat is confined to a recovery area, sanitize the surfaces regularly with pet-safe cleaners. The litter box is another crucial component of hygiene. Scoop it multiple times a day to encourage your cat to use it and to monitor output. A dirty litter box can discourage use, leading to accidents or urinary issues. For sick cats, choose a litter that is dust-free and unscented to avoid respiratory irritation. If your cat has mobility issues, use a box with low sides for easy access. Always wash your hands before and after handling your sick cat, especially when applying medications, cleaning wounds, or touching food and water bowls. This helps protect both your cat and yourself from spreading bacteria or viruses.